where there were these 32 selected global health scholars around the world, and I was lucky to be one of them. And we had an engagement directly with Bill Gates. We talked about research, pandemic preparedness, and some other things like that. It was during my pregnancy I was able to write my RSTMH, Royal Society of Tropical Medicine grant. I won the research grant and I started the project. How dare you get to know that I was pregnant? I went for an outreach. Like, I traveled all the way from one place to an outreach, and I knew that my trouser was not. I knew that my trouser was not like the jean trouser was not smart. So I came back and I told my husband that this, and not quite long. I went for conferences around. I traveled. Sometimes it's not till I'm vomiting at the conference and they say, "What is happening to you? You're not that I'm pregnant." I'm like, "Jeez, you're pregnant and you're here." And I'll say yes.
Amazing. I remember now again how we were able to do this menstrual pad, and you were talking about the science of it. It was so amazing that even from your young mind you could create something, which is something that I believe every nurse have that capacity. Innovation, creativity is really inside of every one of us, and we were able to bet that at that time. Amazing stuff. Thank you for leading the way, right? I wanted to connect it to your mentor. How your mentor supported you, funded it. How were you able to reach to the heart of your mentor? I mean,
all right.
People say everybody is always looking for a mentor. I can't count the number of times people have said, "You wanted to be my mentor."
Exactly.
But such solid mentorship that would yield the kind of quality career path you have been able to build for yourself. How were you able to initiate that kind of conversation?
All right. So, like I said earlier, know what you want to do. Have a good track record. Don't wait for people to come and push you. Push yourself. Then reach out to people to support you in moving forward. You just have to start something. Is there anything you want to do? Any aspect of nursing you want to go into? Is there something you are actually thinking of that I want to go into this? How do I go about it? I think the first thing is not to reach out to a mentor to say, I want to go into this. I need you to mentor me. You have to do the assignment yourself. You have to know what you want to do part-time. It doesn't make sense when you reach out to a mentor and say, I want to go into this. And be asking questions that you can literally get on Google. Be asking them those kind of questions. It's kind of, and don't let me say annoying, but it's a bit irritating. It shows that you've not done your assignments. You're not ready. But when you have a track record, you've already done something. You've done your assignments. You're just coming to them to ask questions, like reasonable questions that even they themselves they would think that, oh wow, see the way this person is actually asking me this question. See the way this job. Oh, that means she's ready to go beyond this. So this is it for me, actually. I've started doing a lot of things before I met my mentor, and I'm so glad I met him because he has been very supportive up till now. You understand? And I'm going to talk about how I've been able to reach out to him and also how I've been able to sustain the relationship. I think I met my mentor 2019 and this is 2023, 4 years ago. And the relationship is getting stronger and stronger. We're getting to know each other. I'm learning the more, and you understand what I'm trying to say. And it's not going to break anytime soon, So that is it. So let me just talk about this. Like I said earlier, there's a place of God. I've been working before now, but then at a point I knew I needed a mentor. So I prayed about it. This is me being sincere. I prayed about it that God, I need a mentor, and these are the things you want me to do, because I believe all these things I'm doing is because God wants me to do it. Like, these are the reasons, part of the reasons why I'm here on earth. You understand? So I prayed to him that I needed someone to guide me, to make the journey easier, someone that's gone ahead of me in the things I want to do. So I just went on Facebook that day. Then Facebook was one of my active social media platforms, and this name is not even on my friend list. You understand? Facebook could bring people you may know. I just saw people you may know. Then I saw his picture, and that thing just clicked. The other two just told me that this is the person. And the next thing I did was to open. I've not seen his profile before, so I opened it and scan through, then I saw that he has done a lot of things. He has been to places I wish to go to. He has done this, he has done that, and I was like, oh really? I was even scared because I don't know how best to reach out to him. Someone that's already working with United Nations. How do I reach out to this person? I was just in school and all. So I just summoned the courage. Do you know what I did? I just went to his inbox. Then I introduced myself. My name is so. I'm a nursing student. I'm in this level. Then I talked about the things I've done in the past. That was where I was talking about track record. I've been able to do this, I've done that, you understand, volunteer for this organization, done these courses online about health system strengthening or about the things you want to do, depending on what you want to talk about. I've done this, then I'm at this stage in my career and I need someone to push me forward. Like I need someone to lead someone that's gone ahead of me to lead me on the next step or to guide me. Let me put it that way, to guide me on the next step or next decision to take and give me the right information that I need to function well, effectively in that new decision I want to take. I just sent it to him. Then I told one of my friends. I don't know. I told it was Tomiwa back then. Yeah. So I told someone that I did this, I did that. I'm so scared. I wasn't expecting him to say no. Like I was already expecting no, but I was just hanging on there, checking it every minute, every hour, checking if he has responded or something. Then boom, he responded and he was like, okay. I think was it his mail or his number he shared on. I think he said we should take it up from the Facebook, then we can see how far we can go. And I was so happy. Some people reach out to you. I want to have your number. I want you to mentor me. Like I was like, thank you so much. Can I have your email address in case I reach out to you on Facebook and you're not there? I can just drop something for you, your email. Then he sent his email address, sent resources to me to read and every other thing, courses to take. It actually started from email, Facebook, then before we graduated to talking on WhatsApp and all. So it was like that for me. I wasn't expecting any other thing. Like, how am I going to put this? I wasn't entitled. Like, I was not expecting that, you should do this for me. Yeah, already. I was doing my assignment. I think that was how I was able to win his heart. Like, I was doing my assignment. If you should tell me to read something, I'll go back and read and come back, ask questions, tell him to give me more materials to read. I just wanted clarity. I wanted deep understanding. I really want to know what to do part-time. Like, you understand, next action and every other thing. So, basically, that was it for me. Then, let me talk about how I was able to sustain the relationship till now. I can basically say that my mentor is like a brother to me now. Like, not like, how am I going to put it? There's this professionalism that we maintain. I'm not going to go beyond that. Like, I'm not going to break that. But we are very, like, he's someone I can reach out to anytime and is ready to provide solution to whatsoever if he has it within his reach. So this is it. Be intentional. Don't just be a predator. Don't just reach out to a mentor because you want to get from them. Be ready to give too. Sometimes I reach out to them. Like I was able to meet my mentor. Then from him, I met his friend that is also a big person. So it was actually a lot for me. Like I was so excited. When you're trying to catch one fish, then another, like you got another big one. You get so.
And I think it works with the United Nations, right?
Yeah, that other one to work with the United Nations. I was like, okay. So I actually reach out to them once in a while to ask them that, is there anything I can do for you? I knew there was nothing I can actually do for them because their level of reasoning, the assignment they are doing, their project, I might not be able to function at that level. But they just saw the fact that this lady is ready to help. She's always asking, is there anything I can do for you? So sometimes they just give me something. They can just say, can you help me check for these resources online? Then send the link to me. You get stuff like that. I will just see. It was out of pure intention, right? Yeah. I don't have any. I just don't want to take from them. I also want to give, and this really helped our relationship. Like now, there are people that can just wake up if there's anything I need to attend to in the middle of the night and reach out to them, and if they are online immediately, they will answer and send back all the things I needed. You understand? So when you're looking for a mentor, don't just come with this predator. I want to be like him and be above him. Go. But be ready to give to them too, so you understand. So that is it for me. And sorry, let me mention this.
Go ahead.
I'm so sorry. Yeah. So you know, you don't need a mentor to start something. You don't need a mentor to don't let me say you don't need a mentor, but then there's a way you can still go about things that you still achieve your end goals. You still be, before I met my mentors, I've done a lot of things. I've traveled for different conferences and all, you understand. Although the place of a mentor will just guide you more, you'll be able to move at a faster rate and every other thing. But just start where you can start. Like just start now, do one or two things, then you reach out to those you want to reach out to later. So that is just it for me. Yeah. Thank you.
You have spoken a lot, and I'm trying to pick some things I want to buttress or even ask further questions on. Amazing stuff, and thank you for sharing again. So let me just say that social media has always been a very great tool, and then in school you will hear, don't do social media too much, it wastes your time. But I have always been of the opinion that it's all about what you do with social media, right?
Exactly.
And this is you also attesting to it, meeting great people that would completely change your life. You mentioned something about traveling, which interestingly I was going to ask about that. So in 200, was it 300 or 400? We were in clinical school then. We had to travel to, I think Egypt, I think.
No, Saudi Arabia.
Saudi Arabia, amazing, yeah, for a conference. And when you told me about the conference, I was like, this is so interesting, because we've not had such. We see a lot of maybe medical students, all other students in different fields going this path, but we've not. It's not so common amongst the nursing community, especially the student community of nurses. When you hear of nurses who are doing so great things, maybe they're already having their PhD, going for conferences. It's not so common among the student community. But here you are, a 300 or 400 level student. We had not even written council at that time. We were not even.
It was before council. I remember going to meet the HOD there, and she was like, "You have council exam, and you want to travel after." And I told her that yes, I'm going to pass the exam now, and I will travel. And she said, "Go bring your CGPA, let me see." And I brought my CGPA, and she was like, "Okay, I think she can travel."
It's so funny because what you just did is something that more like a groundbreaking stuff in this whole. I can count on the tip of my fingers at that time nurses who I know personally that are flying that high. I mean, I know of one person who attended the WHO conference plenary. I've forgotten exactly what it was about. Few people like that. So talk us through how you got that opportunity before.
Okay, so
this.
Yes, please. So I actually want to emphasize on something. When people tell you something is bad, it depends on the perspective you're looking at it from, and also it depends on how best you're able to use that thing. I actually got my first opportunity on social media, and that's on Twitter. Yeah, this opportunity he's talking about was on Twitter, and I remember I opened my Twitter account because of the opportunity. I got, this is me. Let me talk about this so it can actually help someone. If I see an organization and I'm interested in their activities, be it United Nations related or something, international development, public health, I sign up for their newsletter.
Makes sense.
There's a place to put your mail, then they send you mail. Although sometimes it can be annoying when you get a lot of mails and all, but sometimes I take time to check through the mails they send to me to keep up with the activities. So one of these organizations just sent a mail to me. Then they talked about this conference, and I went online to check it out. So I now open my Twitter account so I can actually have a good understanding of what the organization is talking about, what they want to do, and also there was this particular evening they asked the question and they said it's a global organization, like it's not Nigeria alone, it was a global one. So they asked the question and they said people should respond. Twitter, a lot of people are on Twitter, so a lot of people definitely comment. So for me, I was deliberate about my comments. I saw it as an opportunity. People can just see it as a discussion, but I saw it as an opportunity. So I went back, I screen grabbed the question, I went back to read about it. Then I reached out to one of my friends. So I reached out to him to ask him that, okay, this is what I saw, this is what I've been able to put together. What do you think about what I put together, like my write-up? And he said, okay, he was like, okay, you can just stretch this English to this, you can change this to this and all. And I said, thank you. I just went on Twitter to post it, deliberate response. Everything something about this whole thing is being intentional and deliberate. So I just added the comment and I left Twitter. Like I didn't open Twitter at all. Not knowing that they've already messaged me weeks back that I was the one that won the competition and I was going to Riyadh, Saudi Arabia. I think it was even you that posted. You're always very active on Twitter. So there was one day you posted something on Twitter. I think I saw it on your WhatsApp. And then anybody, I have a Twitter account. Let me just go and see what is happening on Twitter. That was how I went to my Twitter, and I saw a message. I was at home that day. I called myself like, I don't understand though. There's something like all these scammers have entered my Twitter.
Scammers.
I said I'm going to Saudi Arabia, and my son was like, come, where are you? You get. So it was just like that. It was on social media, and it was, like I said, it was because I was intentional about. I see everything as as an opportunity. I don't just handle life or any opportunity you get as. Don't just handle it anyhow. See it as a privilege. Then you approach it the way you think you like. Just give your best to it. You understand? That is just it for me, and that was like a game changer. And before you know it, they already reached out to me, my mail, planning the trip, and I think I was the only Nigeria that went for that conference. Yeah, I was the only Nigeria delegate. Although when I got there, I saw some Nigeria that came to moderate, but they are already flying high. Those people that go to different countries and all. Then I saw some Nigerians from another country. You understand? Like they're not based in Nigeria. It was a whole lot for me, and that exposure really helped me. It really helped me because I was able to meet people from different places. Graduate with. Like sitting with people and they're talking about different ideas, innovations. I was like, okay, I think I really need to sit up and do more. You understand? Because when it comes to competition, we are competing against the world. You're not just competing against those in your community or something. Me, I see like when it comes to competition, I see as if I'm competing against the world. Like not like negative competition, right? I see it as positive competition. The one that will drive you, the one that will push you to do more. When you see people succeed, you are not sad about it, but you are motivated to do more. You congratulate them, you jubilate with them, you ask them questions, then you yourself, you strive to do more. Not like, oh, she thought she's the one she's the one doing everything, and you just want to draw back. I don't want to talk to her because she might be feeling herself. No. You move close to those people, ask them questions, and so to me that was actually it for me. I asked a lot of questions. I came back to read about a lot of things, start engaging myself more, getting deeper in all the social activities I've been engaging. And there was even a point I paid for as an undergraduate student. I remember very well. I used my pocket money to pay for a conference in Abuja. Like I traveled all the way from Osogbo to Abuja to attend the conference. Paid with my money, like I did not ask for more because I really wanted to pay with my money so I can feel it, like I can feel what it means to invest in yourself. So a lot of it, right? So that is just it for me.
I can imagine how somebody watching this is going to be pumped up already, because myself, I'm beginning to reflect on my life. How much have I invested into my life?
Please.
It's so amazing, and how you have used social media to your benefit is so remarkable. And thank you for doing all of that. Yes, sometimes you think you're doing it for yourself, but really your story is inspiring somebody, and that's the whole idea of this podcast, for people to know that nurses are not just this old narrative we've always had about nurses are them as people who carry bedpan, who give injections and all of that. There is more to us. There's more to this whole profession than just this. We can make a lot of change both in our communities and even on the global scale, and that's what we've got the capacity, we've got the intellect, and we are made for it, right? I'm just going to quickly wind up this conversation because already there's a lot to unpack, but I don't want to keep you waiting, and I'm going to try to tie two questions together so that you just give your response and then we'll round up from there. So you were able to move from school, you graduated school, and then most of what you did were in school, by the way. After school, I was thinking, Esther will japa immediately. I was really expecting to see you japa, but I saw that you still maintained a different path, and by the grace of God, you are where you are today, working with an international organization while in Nigeria. Why did you choose to? I'm not sure. I don't want to say you are not traveling now, but I'm actually particular about your motivation and what you saw that made you think, there is still an opportunity in Nigeria that you can harness. How did you get into IOM? And aside IOM, you are married, you've got a family, and you're still pursuing all of this stuff we started talking about. You're still doing them. How are you able to manage all of these things? Let's talk about that quickly.
All right, thank you so much. So actually, for me, after my undergraduate study, I knew I would love to go for my masters. I tried working on that, for a while. Then I come to realize that, okay, let me just explore a few opportunities. Like you said, at a point you might need to travel out to gain the exposure to improve on your skills, for good for best practices, develop your knowledge of some things, you understand. But yeah, for me, I think when people ask me back then that when are you traveling, aside the fact that I tried to go for my graduate studies, when people ask when am I traveling, I tell them that, okay, there are still some things I really want to gain before I leave Nigeria, and these are part of the things. Like, there's some experiences I want to gain. There's some box I want to tick before I leave. So I have to just do it. It still boils down to clarity. I'm not pressured. Like I don't have this pressure of, oh, I want to travel, I want to do this. Yes, we all travel. At the point you will need to travel probably to gain best practices or some other things. Yeah, but I just knew that there's some things I need to do, and these are part of the things I need to do. I plan to do. So after school, for my NYSC and all, even for my NYSC, I knew I was going to the preventive aspect of nursing. Like I said, clarity has a whole lot to do when it comes to our journey. We have different journeys, but clarity has a whole lot to do when it comes to our journey and the actions that we take. So I actually knew I was going to go into preventive aspect. So even my NYC was not at the clinical setting, and this really helped a lot too. Yes, it helped a lot with the things.
I remember you worked with Society for Family Health, if I'm right.
Actually worked with something like that, but your state agency for the control of AIDS. That was where I had my NYSC. Yeah. And after my NYSC, I actually picked a role at the facility level with APIN, that's Public Health Initiative in Nigeria, HIV, related to HIV. Now, I mentioned earlier that I'm interested in infectious disease. Yes, I've been working on that part. Try to, even IOM too, we deal with tuberculosis prevention and some other things. So I've been working on that part because there's a destination. I know where I'm going to. That's why I said I'm not pressured. And we all have different destinations. So it's a destination that will determine the kind of road you take or the kind of path you take in life. So that is it for me. And that's actually helped me with my choice of job or activities or decisions. Yeah, let me put it that way. So for IOM, like I said, I wanted infectious disease, and they are doing something related to that, and at the same concurrently they're also helping migrants to live an healthy life. It all still boils down to preventive aspect of nursing, right? It's not like they are sick already, they're healthy, but they're going to another country, and we want to make sure that they are healthy here in Nigeria, and when they get to the country they're going to, and we also want to make sure that the country they're going to is an healthy community. In the sense that nobody's going from Nigeria with tuberculosis to another country, then there will be an epidemic or something. So we're just trying to prevent a whole lot of things, preventable diseases, passing preventable diseases, and some other things like that. So it's still like the preventive aspect of nursing is for me, and that is it about IOM and all, except if there are other questions you want to ask. Yeah, so that actually
I think this is enough dose for anybody who is listening and watching to be inspired enough to get something started. So I actually tied all of what you said to a question: how you were able to balance it with your family life, just in 1 minute.
All right. So so let me put it this way: marry a supportive husband or spouse. Like if you're a man, marry a supportive wife, and obviously let your spouse know the kind of vision you're carrying, the kind of dreams, your dream, your aspiration, what is driving you. I think that really helped me. I had a long courtship period with my husband, and we already became friends before the marriage. So it's just like I'm in a relationship. I'm living with my friend. Like someone that I shared everything with, like my friends. So it's not really hard for me to tell him I want to do this. There's usually some days that we have a live section, and I will say, oh baby, I might not be able to cook now, It is until I'm done with my online section, and you say it's fine. And during the online section, I can try to go to the kitchen and cook in as much as around, So there's not like I'm the man in the house. I'm with my friend. You get? I can tell him anything. I can say, okay, baby, this is what I want now, or this is what I want to do now. Is there a way we can look for a common ground that it won't affect you? And I'm not trying to be selfish. We always look for a common ground. So basically, that really helped, and it's still helping me. Then along the way, my baby came, like my own baby came.
I was going to talk about that too.
Yeah, right. And let me say this, I won't forget to say this. My pregnancy period was like one of my most active period because I did a lot. And what I've been advising some of my colleagues, they are also career women, is that when you're pregnant, just take each day as it comes. I did not think about when I would deliver. When I knew I was, even how dare you get to know that I was pregnant? I went for an outreach. Like I traveled all the way from one place to an outreach, and I knew that my trouser was not. I knew that my trouser was not like the jean trouser was not smart enough. So I came back and I told my husband that this, and I said, guy, I have not seen my period though. And he said, okay, maybe you should just try and check. And I checked, boom. I just came back from one long distance, just to do an outreach, and it's over that I was pregnant, and it was at the early stage, and we were like, okay, I think at this junction you have to take it slowly, and but I won't lie to you, my pregnancy period was just a whole lot of, like, even sometimes I used to wish I have that energy, like, it was a whole lot for me. Not quite long, I went for conferences around, I traveled, sometimes it's until I'm vomiting at the conference that they'll say, what is happening to you? I'm not saying that I'm pregnant. They're like, jeez, you're pregnant, yeah, and I'll say, yes. Do we call your husband? I said, no, don't call my husband, I'll be fine. Then, it was just like that for me. I wrote a lot of exams, I took remote jobs, I went for normal jobs, you understand? I did a whole lot, and I won a lot of things during I think it was during my pregnancy that I was able to have an engagement with Bill Gates, where there were these 32 selected global health scholars around the world, and I was lucky to be one of them. And we had an engagement directly with Bill Gates. We talked about research, pandemic preparedness, and some other things like that. It was during my pregnancy I was able to write my RSTMH, Royal Society of Tropical Medicine grant. I won the research grant, and I started the project. I was just, it wasn't easy, right? It wasn't easy. But I was just giving it my best. I was taking each day as it comes. And I remember there was a time I was down and I was taken to the hospital, and they were like, I'm stressing myself. And they tried to give me hospital, like bed rest. Say, that's when you marry your friend. I have to work. I cannot just be lying down. Can you even bring my laptop from the house? And I said no. And I said,
you will not allow this.
He brought my laptop, and the nurse was like, they didn't know I was the nurse actually, because I did not tell them. I was like, someone that came for bed rest, I still doing pressing laptop around 12 a.m., 1 a.m. in the night. I was like, and I said, please, I have to work. If I'm not working, I'll not be okay. It was just like that, right? It was like, I won't lie to you, it was about my decision that I'm not going to allow the pregnancy to limit me. I'm not going to allow, you can do all these things concurrently. It's going to be challenging. As at this morning before this discussion, I was a bit down because I didn't sleep all through the night, caring for the baby, this. I was a bit down, but I have to just pick myself. If I didn't tell you, you wouldn't know that I was a bit down in the morning. You get?
I did not even know. Kudos to you.
So I just have to pick everything up. Life, family, career must all work together. One cannot, you can't stop one for the other one, because at the end of it, you'll regret it, and nobody will listen to that. Oh, I'm not as high as this because at a point in my life, I had to put everything for my family or to raise a child. Nobody will listen to that story. It's only success has a lot of friends, and failure, like nobody wants to associate.
Nobody wants
a failed person. So you just have to keep doing. You just have to, even at that point when you are down, you might not be able to work at your own pace or at your normal pace or at that peak you want to work at. But just try and do something. Do something. All those small things, they all mount up to something at the end of it. So that's just it for me, and that's really helped me.
Jesus, this is a whole lot. This is a whole lot, Esther. And I feel like I've even disconnected with you because you're talking about meeting Bill Gates and everything. I never hear about that one. So. But don't
It's
worry, at the
fine.
end of all of this, we are going to talk more about that. This is so amazing.
Okay.
And thank you, thank you,
Yeah.
thank you, thank you for coming on this podcast. We really
Thank you for
appreciate you.
having me. Thank you for
Yeah.
having me.
This whole organization is run by, is actually convened and ideated by Professor Priska, whom I believe you also know,
Yeah.
and Professor Adebayo Adejumo.
Oh
And they've
yes,
been, they are people who are so passionate about young nurses.
I
Um,
am aware.
yeah, and that's really why we felt okay. Let's bring young nurses who are doing stuff, who are doing great stuff, and they have given us this platform. And we say thank you to them, and we say
Thank
thank
you
you to
so
you as well. Thank you to you as well for
much.
coming. There's a whole lot I can still keep asking you, but man,
I know,
we are
right?
far beyond the scheduled time. So I'm
I
just going
know.
to allow you to go take care of my wonderful friend and genius that you are raising, and God will continue to help you in Jesus'
Amen.
name.
Thank
All
you.
right. So,
Amen.
for anybody who wants to connect with you in 1 minute, your social media handles you just want to share with anyone.
All right. So on Facebook I'm Esther Ilesanmi Esther Bosedi. Although for a while now I've been doing underground work. I'm not really putting a
Mm,
lot of things on social media. Sometimes it's about the work, not just the publicity. But with
true,
time we'll
true.
be back. Yeah. So that is it. So
I'm waiting for
yeah.
that.
Yeah, I'm actually going to be back, but then I just have to get grounded first, some things and all. So on Facebook, Ilesanmi Esther Bosede, on LinkedIn, Ilesanmi Esther Bosede, then on Twitter and Instagram. Okay, let's stick to LinkedIn and Facebook here. I think that's okay.
Yeah. Makes sense. Thank you so much. Thank you so much.
Thank
And to
you.
everybody who is watching, I hope you have gotten something valuable for your time. And I believe that this whole thing will add a layer to your motivation and to your inspiration. But remember that success is 99% perspiration and just 1% inspiration. She has shared her story with us, and we believe that what she has shared is an inspiration to cheer you up to now go on your own path and journey of success. And cheers to the greatness and to the success we are all becoming. All right. Thank you very much.
Yes.
Thank you so much.
Thank you
And
so
we're
much
going
for
to
having me. Thank you so much. Do have a lovely evening.